My name is Marian Conder, and today I will be discussing the APRN Prescriptive Authority and its implications for access to care, ethics, and advanced nursing practice. Prescriptive authority is one of the most significant professional practice issues affecting advanced practice registered nurses today. Although APRNs receive standardized graduate education and national certification, their ability to prescribe medications independently still varies by state. These differences create important consequences for patient access, workforce distribution, and healthcare delivery. Prescriptive authority refers to the legal ability of APRNs to prescribe medications independently. Some states grant full practice authority, meaning APRNs can evaluate, diagnose, and prescribe without physician oversight. Other states require ongoing collaborative agreements or supervision. These variations are not based on differences in APRN education or competency. Instead, they are largely driven by legislative and historical factors. This matters because prescribing authority directly affects how quickly patients receive treatment, how efficiently healthcare teams can function, and how fully APRNs are able to prescribe to the extent of their education and training. The literature consistently shows that expanded prescriptive authority benefits healthcare systems. Research by Kanandrik and colleagues found that states with fewer restrictions have a stronger APRN workforce supply. Yang and colleagues found no evidence that expanded authority decreases patient safety. However, in restrictive states, APRNs may experience delays related to required physician signatures or collaborative agreements. These administrative barriers can slow treatment and increase healthcare costs. From an ethical perspective, this raises concerns about justice and access. When restrictions disproportionately affect rural and underserved populations, they may contribute to inequitable care delivery. Prescriptive authority is not just a professional issue, it is a patient access issue. In rural communities, APRNs often serve as primary care providers. Physician shortages are common and travel distances are long. Requiring physician oversight in these areas can create unnecessary delays. Urban, underserved populations also experience provider shortages and long wait times. Expanded prescriptive authority allows care decisions to be made during the same visit, improving continuity and reduced fragmentation. Evidence suggests that states with full practice authority demonstrate improved workforce distribution and better healthcare access. To address this issue, advocacy is essential. First, APRNs must continue supporting evidence-based scope of practice legislation. Second, advanced practice nurses should remain engaged in policy decisions at both the state and national levels. Increasing public awareness of APRN outcomes and strengthening interdisciplinary collaboration are also important strategies. The National Academies of Science, Engineering, and Medicine emphasize that nurses should practice to the full extent of their education and training. Expanding the prescriptive authority aligns directly with this national recommendation. Ultimately, policy reform should be guided by outcome data rather than outdated perceptions. In conclusion, APRN prescriptive authority is a critical professional issue that influences workforce sustainability, patient access, and ethical healthcare delivery. The evidence does not support restrictive prescribing laws as a means of improving safety. Instead, expanded authority is associated with improved access and efficient healthcare delivery. As advanced practice nurses, continued leadership and advocacy will be essential in shaping policy that supports safe, equal, and patient-centered care. I would like to leave you with two discussion questions. First, if evidence consistently shows that APRNs prescribe safely and effectively, what factors continue to drive restrictive prescriptive authority laws in some states? Second, how might expanding prescriptive authority improve healthcare equality in rural and underserved communities without compromising patient safety? Thank you for listening.